Look, what we're seeing is what we always feared. We knew that when the social distancing measures in the wider community were relaxed, all that was doing was increasing the risk to vulnerable older Australians in care. And unfortunately, with widespread community transmission of the coronavirus in the hotspots in Victoria, it's made its way into aged care homes. Notwithstanding all the efforts that we've put in place around minimising and mitigating those risks, we know we can't eradicate that risk completely. And now our focus as a sector, but also for all the other agencies, both state government, federal government, hospitals, is clearly on protecting older Australians in care.
This does highlight some problems with the sector, though. A lot of staff are underpaid, and facilities themselves are understaffed too.
Well, look, the issues around staffing and payment, we've long advocated that we want more staff, we want them better skilled and qualified, and we want them better and appropriately remunerated. These are issues that have been discussed at the Royal Commission into Aged Care Quality and Safety. We anticipate that they will have a view around how to resolve those matters. But our focus right now needs to be on protecting those older Australians in care and keeping the people that care for them safe and well as well. And the way to do that, the number one thing we can do is stop the spread in the community.
Was the government too slow?
Look, I don't think we can comment on that. I know that everybody is working extremely hard. We have never dealt with a pandemic like this in our lifetimes. We felt that our initial response when we had isolated outbreaks in individual facilities was appropriate. We learned a lot of lessons from that. But what we've seen is what we feared most of all is wide-scale transmission in aged care at pace. And that has stretched the resources that were made available. But we've responded quickly by putting in place, with the federal government support, the AUSMAT teams, the medical assistance teams, the establishment of the Victorian Aged Care Response Centre. And a game changer has been Premier Andrews basically stopping that non-essential elective surgery and freeing up nurses and other health workers that can come and replace those staff in the facilities that have been stood down either because they have infection or they've had close contact.
It took a long time to do that, though.
Oh, well, look, this has been an unfolding situation. There'll be inquiries and other measures that'll be put in place to get to the root cause. What we're doing is everything we possibly can, minute by minute, to keep older people safe. And I know that I was on the phone this morning talking to the people at the Epping Gardens, ensuring that everybody is safe and well there. We know that they now have RNs on site looking after the residents there. They're reporting that they are safe and being cared for. We now have a communications team. The Minister assured me that there's a comms team on site now helping with communications with loved ones. And there'll be further measures putting in place to make sure that people are kept up to date and that their loved ones are being cared for appropriately.
Why would Heritage Care in Epping Gardens have refused to relinquish control of the centre?
Look, I heard that reported this morning. I don't have the details of that. What I do know is that response centre staff have been on site. We spoke to them yesterday. We've spoken to them again this morning. If there is an issue with regards to the operator and any factors there, that would be a matter for the regulator. The primary focus here is making sure that the people, the residents on site, are being cared for, and I've been assured that that is the case.